This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset me.
Painful, tender to the touch. May also
Same shoulder length, and the other.
Hello, and welcome back to another episode of the Real Health Podcast with Brandy and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandy Rashidian is my other half co-host of this soon becoming and fast becoming very popular podcast. It was very neat. One of our patients said they were in a like a get together, like family, and she said she was talking about the podcast, and everybody was like, "What is this? Tell me," and they were talking about some of the things we talk about, and I guess somebody else at that meeting or at the gathering had watched us, and it's neat. We're being talked about, which is awesome. Which means there's some impact, which means there is some value to the information we're sharing with you. And so just so you know, if it's the first time you're watching us or listening to us, Frederick, our podcast, Real Health Podcast, is brought to you by the Frederick Podcast Network. It's found on listenfrederick.com and also found on YouTube and Spotify and Apple Tunes and all of those. And our purpose is to bring you information, the latest up-to-date information on health and wellness, research articles, diseases, treatments, whatever else you could think of. And what we want to do is give it to you in a wellness perspective, non-drug, non-surgical, healthy way of improving your life. What we hope you'll get from it will make you feel better, get stronger, live longer, and feel younger.
Yeah. It was funny. I watched a little video clip this week, and it was, I guess, a woman who maybe had gone on. She used to do regular videos, hadn't been doing it recently. And she's like, I was never one of those crunchy kind of people. We're crunchy. Did you know that?
I had no idea.
That's how we're referred to. Crunchy or granola or all sorts of stuff like
I might
that.
be a little crispy. I don't know if I'm crunchy.
But it's so funny, the perception that is shifting in our country. Finally, thank you for those of you who are helping to lead the charge in the government to make these changes. Kennedy really leading that in a big way. Because now with some of the release of this information about, our foods and about pharmaceuticals, and it's changing how people think. And they're like, you know what? I think I kind of identify as a crunchy person. Like, I didn't know that these are the things that were happening. I didn't know that I wasn't being protected. I didn't know that the food I was giving my kids is not only not healthy, but actually harmful. Do you know what I mean? Like, how many of us would have had our kids, grabbing a bag of chips or a bowl of cereal or whatever, and going, I know that's not the healthiest thing, right? Like, but we're in a rush. Like, we're a busy family. We have to do that. And now people are going, maybe I need to take a second look at that. It's not that it's just not the healthiest alternative. It's that there are ingredients in there that are actually creating harm to our health and harm in our bodies and our children. And no one has stopped them. Matter of fact, they've been protected up to this point. So now it's all coming to light, and people are like, oh my gosh, these crunchy people aren't as crazy as I thought. It's just like all the conspiracy theorists aren't necessarily conspiracy theorists anymore.
It's what leads to, and that's the whole thing with the whole Make America Healthy Again movement, is to eliminate long-term chronic diseases, which are lifestyle based. They're
right.
And it's the little things we do. You know what they call it? It's called the compound effect. Yeah,
which we like it if it's money, right?
Compound effect in money means you get interest on interest on interest, and your money starts to grow exponentially if you leave it in there long enough and you don't touch it. Well, it's the same exact thing. You can have two people, one person, all they do is, hey, I'm just going to eat natural foods, unpackaged foods,
right,
unprocessed foods, and that's it. And you know what? And his, let's say his best friend just keeps eating the cereal and the things that come in boxes and packaging and food dyes and all that stuff. You know what? A year later, they look the same. They feel the same.
Right.
5 years later, they probably still pretty much look the same, feel the same.
Maybe a little bit of a change.
Maybe a little.
If
Yeah,
you know
maybe
what
a
to
little.
look for.
Maybe one has a little more energy than the other. Maybe one's a little body fat than the other.
Maybe one's skin looks a little bit better than the
Yeah.
other. Their eyes might be a little brighter
But
than the
not go
other.
another 10 more years. And another 10 years. I guarantee you that little difference is drastically different
Yeah.
in how they look. One of them will literally look 20 years older than the other.
Yeah.
So we're ourselves by making these compromises and dealing with them. And you know what that ends up? Chronic diseases put you in the hospital.
Yep.
A person we both know very, very well, her brother passed away recently. It broke my heart because she took him to the hospital, and he's got other chronic issues that need immediate attention. He was in severe pain. The people in the hospital put him on a gurney in a hallway, left him there for over 7 hours
It's crazy.
unattended, not giving him anything to eat or drink, just left him there. Then they finally looked at him and released him. He coded in the parking lot, meaning no pulse, totally unconscious. They had to get people to come to the parking lot, take him back in,
I wonder how long that
resuscitate him.
took.
Resuscitate him, yeah. And unfortunately, he passed away. And so our friend, this was her younger brother.
It doesn't make sense. And these are the stories often we don't hear about, right? Like, we know that our hospital systems are really broken. If anyone's tried recently to try to get in anywhere, it's very difficult. You often get turned away or told, we can't really do anything for you, or you're going to sit out here for hours on end. That's not healthcare.
Yeah.
Like, let's just relabel it to what it is so that people don't misunderstand what they're there for. Right? Let's change that definition or that term that we're using, that we're calling it, because
So a baby came in as a new patient. Obviously, parents drove him in. He didn't come by himself.
he was very mature for his age. Sorry.
Not walking yet. Newborn. He was born late February, so he's a little over a month and a half old. And so anyways, this baby has a posterior tongue tie. Well, dad was in the military, so they're in the VA system. And they said it's too far posterior for us to release it. So there's nursing issues, latching issues, weight gain issues. And I go, you're going to have to go outside of the system.
100%.
So I recommended them to go to the place in Baltimore where it's a tongue tie specialty clinic with experts. All they do is deal with tongue ties. I said, you go there. And so I called them that night and I said, how's the baby doing after first adjustment? Doing fine. And they had already made an appointment. They're going to go there.
Good.
So, don't take no for an answer.
Yes.
Because they were like, oh, okay, well, if this doctor says this can't be corrected, it can't be corrected. But no, a tongue tie in a newborn affects skull development, affects speech, but affects brain development, and it can lead to things like asthma, allergies, and sinus issues. It can affect a whole lot of things.
Yep. I laugh when they say it can't affect speech.
And
I've been told that with all my kids, and I'm like, oh, you're funny.
Not only that, this
all
child
goes together.
is having trouble gaining weight right now,
Right.
because of nursing issues.
Right. And part of the issue is that when they have tongue ties like that, right, the tongue is such an important part of nursing because that tongue needs to be able to come around, right?
It comes up, pushes the nipple to the roof of the mouth, and pulls back. So there's no suction because they can't breathe through their mouth. Babies can only breathe through their nose, newborns up to 3 months. And so what they're doing is they're using their tongue to nurse.
Right.
But also pressing on the roof of the mouth affects the sella turcica, which is a bone in the skull where the pituitary gland sits, and that bone will pump the pituitary to release growth hormone. And so if that pumping action doesn't occur because the tongue can't push the nipple to the roof of the mouth, growth hormone doesn't get released. That's the second reason why this child is not gaining weight.
Right. This is part of the reason that nursing is so important. And that is not
It's not just the nutrition.
Correct.
There's mechanical benefits to it.
And I do fully understand sometimes women have trouble with that.
Correct.
So that's not a shaming thing.
No.
If you couldn't do it, you couldn't do it.
But you can always wash your hand,
Mhm.
use maybe your pinky, and put your pinky in the baby's mouth and gently massage the roof of the mouth for a minute or two, a couple
Yeah.
times a day.
Yep.
And listen, the pressure should be the weight of a nickel. You're not pressing hard.
Yep.
Just a gentle pressure. In fact, they'll probably do it for you because they're going to be suckling as if that finger is a nipple.
Yeah.
If you've ever put your finger in a baby's mouth, there's very strong suction there.
Yeah. So and I love that we can talk about these things because how many of you women out there knew that? Like how many knew how important that is?
How many
And if you-
pediatricians know that?
They don't even read their own journals. Sometimes they don't even know they're not supposed to prescribe antibiotic for an ear infection, but that's another topic for another day. We're not talking about that.
Disclaimer. The attorneys are calling. I heard the phone ring.
I said we're not talking about it.
We're not talking
It's
about
not
it.
on our list today.
We did not talk about it. Do not rewind. Do not re-listen.
Although there are a couple of really cool things, not to switch gears.
Yeah,
but
what's in the news?
a couple of things in the news. We're going to be talking about two specific things today, which is melatonin and the placebo.
We're going to
So-
discuss those passionately.
Yeah, so I'm really excited about that, but I didn't want to miss anything that was possibly important in the news this week. So a couple of things. Antibiotic resistance popped up. Antimicrobial resistance still remains a global concern, a major global concern, while overprescription in clinical setting plays a role. A leading contributor is the widespread use of antibiotics in agriculture, particularly in China, Brazil, and India. Experts emphasize international collaboration and regulation on agricultural antibiotics used to combat this crisis. So keep an eye on that. We should be eating foods that do not haven't been treated with antibiotics. Like it's important. So watch that in your meat and your milk. Artificial intelligence in healthcare. AI continues to revolutionize healthcare with applications in diagnostics, treatment planning, and patient monitoring. Breakthroughs in predictive analytics and personalized medicine are making AI an essential tool for practitioners and researchers alike. The more I use AI, the more I go, there's going to be more applications where I think it's going to be useful. I think it's going to remove a lot of issues.
It can also be dangerous. I mean, we did a video. It's on our YouTube channel where Dr. Michael Lacey went up against AI.
Yeah.
And there was a case study, and I watched that video and I said, I think the AI really missed the boat on this because it was the case was a patient who was having upper back pain, radiating pain down the arms, and the AI recommended a course of treatment, and Dr. Michael said, "Well, I agree with this course of treatment, but we don't have X-rays."
Right.
So the AI went strictly based on history.
Right.
Yet I believe there's so much to be missed because AI said, well, 2 to 3 weeks of 3 times a week should release this person's pain, which I agree. Dr. Michael agreed.
Right.
Unless there's bone spurs.
Correct.
Unless there's disc bulges. Unless there's massive degenerative changes, scar tissue or whatever else it might be. And so there's no way to know. What if there's pathologic fractures in that spine? What if there's discitis?
Now, what I would like to see then as the next challenge to that is get those x-rays available for that AI, agent to use.
Right. Now,
to then see what it is.
At that point, yeah. But sometimes someone will put information like
I
that
agree.
into AI. They'll get that result and they'll say, okay, this is what I need. And
they won't
they won't look into it. And one of the biggest things is gallbladder issues can cause right-sided upper back shoulder blade pain. So nothing about gallbladder in that AI response to this patient's history.
Right. Wow.
But if a doctor who's looking at the patient, examining the patient, thinking about it, well, listen, why is your heart rate a little high? Why is this or that? We know stomach issues can refer pain to the chest, to the back.
But right now we have a medical system that our humans aren't doing that.
That's true.
If somebody has been put on a blood pressure medication and and maybe a high blood a high blood pressure and maybe a cholesterol medication or something like that. And then say they go 5 years, they've lost weight, they started exercising, their nutrition is different. How many doctors say they have to switch doctors? Maybe that one retired. They go to a new physician. How many just go, oh, okay, they're on that. Okay, we'll continue that. But don't look and take into account that somebody just lost 20 pounds and
Right.
they're working out regularly. And
We
do
have
you know what I'm
so many
saying?
patients on beta blockers who come in and we start correcting their spine, and their bodies become more efficient. When the body becomes more efficient, their heart rate normalizes, their blood pressure normalizes, and all of a sudden now they're too dizzy. They get lightheaded every time they stand up,
Right.
every time they get out of bed, every time they get out of their car, they're lightheaded, they're going to faint. And they go back to the cardiologist saying, do you think I still need to be on this? And when they remove the blood pressure meds, that stuff goes away.
Now, I think what we'll probably see as AI develops is we're going to have specific, like AI driven, software that's specific to, say there will be
Yeah.
one specific to chiropractic diagnostic, specific to,
The information you get from AI is still dependent on the quality of questions you ask it.
100%.
You have to ask the right questions. If the question you ask AI is, what is the treatment for this? It's going to give you a treatment.
Right. And it's going to be general.
What if you ask AI, what more information do I need to get an accurate diagnosis?
Correct.
That's a better question. And then say, what other diagnoses are possible with this condition? Get that. Then ask the question, how do I rule out all these other things? And AI will tell you that. And then once you know for sure, now you go, okay, how do I treat this?
Right.
Don't go to treatment right away.
I agree with that. The questions are important. And I also agree that I don't think AI should be utilized without the human perspective and touch. I think that there's, as we know, because they're using human brain cells in certain computing right now. It's actually disgusting and scary, but that's probably a topic for another day. But and the processing power is nuts. Like no computer can come close to it, right? So I don't think we can ever remove the human application portion of that. I think that's necessary.
Not just yet. Yeah. Not,
I don't know if we ever should.
Well, yeah.
But-
There's still literally they're working on devices. You remember in Star Trek when bones were broken, they would take this computer and
I would
go,
totally take that.
go over the bone, and it would heal the bone, heal burns. That stuff is real, and that's coming.
That's kind
read
of fun.
read Tony Robbins' book. It's called Life Force,
Yeah.
I believe. Incredible stuff.
I think I got halfway through it.
All of
I'm
that
not a
is
finisher.
being developed right now, and it's incredible. And there's a lot of it is already developed that's out there. I just wish we all had access to it. Man.
Well, I think we just might soon. The rate at which information comes out, if you're willing to do the research,
Yeah.
and you're willing to look for it, you're going to find stuff. That's why we find what we find, because we do that. We do our due diligence in that. Just a couple more things before we jump into placebo and melatonin. HHS restructuring. This is actually kind of exciting. Health Secretary Robert F. Kennedy is spearheading a major restructuring of the Department of Health and Human Services, which we all know about. Over 200 HIV-related research grants have been canceled, and about 10,000 positions across the agencies such as FDA, CDC, and NIH are being cut. The goal is to streamline operations and reduce redundancy, but critics warn of potential disruptions to essential public health initiatives. I personally am not worried about that because I haven't seen very many wonderful health initiatives coming out from those agencies, but I'm sure there are some I'm not aware of. I'm always sad to hear when people lose their jobs because I know that's a tough transition. So the human aspect of that is not lost on me. However, our government is riddled with unnecessary like overlap and redundancy in these different departments. So it'll be nice. Maybe something will get done,
Some of
and
these
it's not
research
going to take 10 or
projects
20
are
years.
Worthless. We've reported on a
100%.
ton of them where we're like,
100%.
you spent money researching what?
And then to come out with, we need more research.
That's always the answer.
Yeah.
It's ridiculous.
So, and then there's an mpox epidemic in Central Africa. think that impacts us too greatly here. And then WHO budget shortfalls. Again, not a
That's
huge.
because U.S. pulled out.
I know.
U.S. was paying, what, like 55% of their budget?
Yeah, so they now are facing a $2.5 billion budget shortage for 2025 to 2027. But I'm not really sad about that either.
This is an agency that what they do is they get information and disseminate that information. That's what they do. Information about healthcare, and they send it out to everybody. This is the age of information. We are beyond the age of information.
We don't
We're in the
really
age
need you
of
anymore.
artificial intelligence at this point. All information is at your fingertips. Every doctor
Exactly.
can look it up.
The one thing I did think was interesting is microplastics in drinking water. There's some new research that highlights the health risks, which we all know, of microplastics found in tap water. So now not just in the bottled water, but now it's in the tap water also, including there are risks with the microplastics, including links to diabetes and stroke. Simple at-home solutions such as boiling and filtering water can remove up to 90% of microplastics. So now they're asking us, for those of you who have tap water, safety first, boil your water before you drink it.
What was that other article that said only drink tap water? Do you remember?
Oh, that was ludicrous.
So, but anyways, also this proves that you can't clean your environment enough. So what you have to do is stabilize and strengthen your body.
Yes.
Which
That's
is
the
what
only thing you can control.
The book is all about, right?
Right.
If your liver's filtering everything correctly, your kidneys are filtering everything correctly, you're detoxifying your body properly, and the systems of your body are working well, you can afford to put some toxins in, and you'll deal with it properly in a healthy way, and it won't have long-term ramifications.
Right.
Get healthy. That's more important. Obviously, filter your water, and it's not that hard. Get a water filter.
And water is actually one of those things that you is such a necessity. It's life sustaining.
Yep.
So you do want your water to be clean.
Sure.
Like it's one thing that we need to make sure is done.
So now the moment of truth. This is where we had a discussion last time, but we never recorded that discussion because we were going to talk about it today.
Yeah,
So
I'm not feeling as emotionally charged today.
No. All right, good. We'll be civil.
I don't even remember what we were debating about. I'll try. It'll probably come to me.
I was saying placebo is a drug, and you were saying placebo is not a drug. It deals with things that are the diseases that are not actually real.
Well, I wasn't. I don't. That's not really what I was meaning. That it's not a real disease. It's not a real diagnosis, but I do think that I personally believe that there are other causes for what people may be experiencing from a mental health perspective that isn't necessarily health disease related. So
Dr. Fred Barge said the placebo is the only drug that has withstood the test of time.
well, I would agree with that.
Because all other drugs have some kind of a negative drawback.
And for the record, I love the placebo. I do not have an issue with the placebo.
We
I would
agree on
much
that.
rather see
Yeah.
that than see, you know what I mean?
Well,
So
let's dig in.
my contention was something else. Okay.
The article title, The Placebo Effect Can Be Good Medicine for Pain and Other Problems. So this person, Catarina Craveiro,
That's a nice name.
a biomedical research technician from Lisbon. Lisbon is Portugal, right? Lisbon's in Portugal.
I don't know.
Sean, do you know Lisbon's in Portugal?
I thought isn't there a Lisbon in England too?
No. Well, there's Lisbon in
Woodbine.
Maryland.
Yeah, like right near
next
Woodbine.
to Woodbine.
We
But
used to be there.
this name doesn't sound like a Maryland name. It's Portugal.
Oh,
All
look
right.
at him being right again.
Had been hobbled by lower back pain and from scoliosis since childhood, unable to do much physically and dependent on ibuprofen for relief. She said, it really interfered with my life. I had bad pain. I wanted to do the same things as my friends, and I was not able to. In 2013, she signed up for a clinical trial, expecting they had some magical drug that would take her pain away, and was disappointed and skeptical to learn that the research would be studying the effect of a medically inert placebo, which looks like a real drug and is taken like one, but lacks active ingredients. She said, I didn't believe it was going to work, but gave it a try. I couldn't be any worse than my actual situation at that point. Today, at age 33, she's pain-free, a competitive kickboxer who now coaches the sport, and mother of 2 sons, convinced none of this would have been possible earlier, and she's a believer. Our mind is a powerful thing, and that in my subconscious, I wanted so badly to feel better that the basic mechanic action of taking a pill, even though she knew it was medically inert, did the job, she says. I had no doubt that the willingness to get rid of the pain combined with the taking a pill took my pain away. This is a powerful thing because
It is very powerful.
some people, and I see this regularly, being in healthcare for the past 25 years, being in actually longer than that, since 1992, really. I noticed that there are some people who identify with their condition so much that they don't want to get rid of it.
Subconsciously. They consciously say they do,
Right.
which is why they are typically seeking,
Yeah.
some type
Right.
of answer. But I mean, there's the old adage that says you don't do anything if you're not getting something out of it, right?
Yeah.
So good or bad.
Yeah.
So and like I said, I don't think it's people do this consciously.
Right.
I really, vast majority of people have no idea
Yeah.
that that's happening. But for some people, it's attention.
But if an
It's
elderly person who is a bit lonely
Mhm.
gets some sympathy from someone younger who
yeah.
is being kind and listening to her medical complaints, there's a lot of benefit to that
yeah,
for them.
yeah.
It says the placebo effect is a phenomenon that occurs when a person's physical or mental health improves after taking what is essentially a sham treatment with no clear therapeutic benefits. The placebo effect is not magic. Years ago, this sounded futuristic. Now it is part of science.
I hate that they call it a sham treatment because I don't think it's that. I don't think it's a sham.
No.
You know what I mean? I mean, when you're actually telling someone that that it's a placebo,
Yeah.
and it still does something,
Yeah.
that's amazing. That's the power of the mind right there.
Historically, the placebo effect typically was seen in context of deception. Patients didn't know they were receiving an inert substance, but still got better because they believed that they would. I knew a doctor, he was a OBGYN, and literally he had these bottles with droppers on it, and he would fill it with water, and he'd give it to these ladies who were having issues. He's an obstetrician, OBGYN, gynecologist, and he would say, I want you to take 8 drops under your tongue in the morning when you first wake up and at night before you go to sleep. And these people would get better. But he would literally say, take this dropper, and no more than 8. It was water.
I've heard living water is pretty powerful.
No more, but it was in a bottle, and it had a dropper, and it looked, and he'd be like, listen, I don't have much. Don't lose it. Be careful with it.
Yeah.
Don't give it to anybody else. Don't let children near it. Like, he would say all these things. But that's this where it says deception. It's deceptive. And some people would say that's malpractice. But
Well, it depends on how much you're charging for it.
it's water. Yeah, I wonder if you build insurance for that. Ethicist Arthur Kaplan. Here we go.
I don't even know what that is.
Bioethics, for example, recalls one of the first cases he consulted on decades ago when a physician sought his advice about giving low-dose aspirin, especially now. Aspirin actually does have side effects.
I know.
But anyways,
That doesn't feel like a placebo.
Essentially a placebo in this instance, to an otherwise healthy woman suffering from exhaustion. The doctor feared if he did nothing, this single mother of 4 who worked 2 jobs, bus driver and office cleaner, might go elsewhere seeking amphetamines, stimulants that can be addictive. Abusing them can potentially cause dangerous physical symptoms and psychotic effects. Kaplan approved of the idea, and while the dishonesty probably was questionable, the sham treatment worked, restoring the woman's energy and relieving her fatigue. In fact, it says she came back 2 months later and she was very happy that she didn't have any issues.
That's awesome.
The researchers now believe that the placebo effect can happen even when patients know they are getting a placebo, a process known as open label use. For this reason, experts believe clinicians should include them in mainstream medical practice, but be entirely truthful with patients. You never tell a patient it's going to work, says Ted Kapchuk, professor of medicine at Harvard Medical School and director of the program in placebo studies. Okay, so he's saying don't be deceptive, don't be dishonest. But if you're giving someone just filtered water,
Right.
not aspirin, water, not even like a vitamin C pill, not even like a sugar pill, water, and being dishonest about it increases the chance of them getting better.
Mm-hmm.
Now, they're still going to probably get better knowing that it's a placebo. I don't know. Is it really considered dishonesty? It says honesty is critical. We make it crystal clear. This is a placebo, no active ingredient. It's like a sugar pill. It might work. It might not work. Improvement can be quick or gradual. It's a crazy idea, but we have evidence that it works some of the time.
Well, I mean, here's the thing. Let's not act like transparency is something that's vital in the medical field.
Oh my goodness!
Because it's riddled with misinformation and incorrect guidance.
How many times, you guys listening right now, you can tell me, how many times you go to a doctor and the doctor gives you a drug and says, oh, there's no side effects. And then you read the label, you see the TV commercial, and you're like, okay, may cause sudden unexplained death as a side effect.
Yeah.
Guys, that's not a side effect, that's an effect.
Right. Right.
Why are we calling it a side effect? That's a marketing term. They put the word side in front of it, and it doesn't seem as bad or sound as bad.
Yeah.
It's an effect.
There's some really funny effects from the commercials actually crack me up. But
so it says pain, anxiety, and depression and fatigue are good things to use placebo for. Placebos don't shrink tumors or lower cholesterol. I beg to differ. Especially cholesterol is stress related. Mm-hmm. And if something does reduce your stress level, cholesterol does go down. Cholesterol is the precursor to all the hormones in your body, including cortisol, testosterone, estrogen, progesterone, and growth hormone. And what happens is when your stress level normalizes because you think you took a magic pill, your cholesterol will go down because the need for some of these hormones decreases. So don't tell me it won't lower cholesterol. I guarantee you it will. And it says they don't cure the common cold. No, but they will boost your immune system, which will make you get over a cold much faster. So that's what this guy says. But they do relieve symptoms for things such as chronic pain, cancer-related fatigue, osteoarthritis pain. It doesn't get rid of arthritis. It doesn't get rid of the arthritis, but it can get rid of the pain, which is controlled by the brain.
Mm-hmm. Man, how cool to be able to turn on and off your pain receptors.
Now, this contradicts too, because now he says if there's this trusting doctor-patient relationship, and the patient feels supported by the doctor, the placebo has a higher chance of working. I go, but then if the doctor says, hey, this might work and it might not, and it has nothing in it, and it sounds crazy, but go ahead and take it anyways, which is what they're telling the doctors to say. Well, how does the patient feel supported, loved, and cared for?
Right.
And how can a patient trust a doctor who says, I don't know if this is going to work, let's try anyways? How about some certainty in that?
Yeah.
How about when the doctor says, listen, you do everything else right, this is going to have a big impact in your body.
Right.
Let's give it a shot. I think that sounds a lot better.
Right.
Let's say your house is burning down. Okay, your house is, there's smoke everywhere, right? There's fire. And this guy comes in a firefighter suit, mask, oxygen tank, all that stuff, and he goes, hey, this place is burning down, ma'am. I don't know if I can save your life or anything, but I might be able to save your life. So I think the exit's this way. Wait, no, I think it's that way. Why don't you follow me?
This may
and
work, it may
we'll
not.
figure it out. We'll either live or you'll die. I got oxygen, so I'm okay, but you'll probably die. But let's go. Or do you want that firefighter to walk in and say, come with me if you want to live?
Right.
That's a line from Terminator.
Yes, it is.
I know. Anyways, but you want that confidence. I mean, you're going to this doctor for help, right? You want the doctor to be that
very true.
firefighter who charges in with confidence, with all the equipment, and says, I got you. Let's go. I'm getting you out of here, and you're going to live, and I'm going to do whatever it takes to get you better.
Yeah. I like it.
That's the kind of doctor I want.
Me too.
All right. Well, I think that's the whole article here. It says
think so,
there's no they can't explain how it works or why it works with some patients and not others. I think half the placebo is how you present it.
100%.
That's my opinion. You want to hear a story?
I love stories. I'm going to drink my hydrogen water while we do that. I was getting sleepy and yawning.
Yeah, these things. H2 tab now being sold at Mid-Atlantic Chiropractic Center.
All locations.
Wow, that's cool. That sounded nice. All locations. We're growing, by the way. We're going to open a third office in a few months. Here's the story. There was a young boy. I think he was about 18 years. Now, where did I hear the story? I was sitting in a Vistage meeting. Vistage International, which is a group of us, 12 CEOs, business owners around this table in a conference room, and we had a presenter come and tell stories. And usually these speeches are about business and business development and whatever else comes with business, staffing, hiring, management, leadership, all that stuff. But this was a doctor talking about a patient that he had, and he was a neurosurgeon, brain surgeon, and he said patient came in, 18 years old, male, had a astrocytoma in the brain. This is a tumor that has tentacles that goes throughout the brain. He said it's inoperable. He told the patient, I can't operate. This is fatal. I'm not going to be able to do anything about it. What I'm going to do is I'm going to refer you to this psychotherapist, and he's going to kind of talk to you and help you emotionally deal with what you're going through right now. And I don't know if he said you're going to die in a year or what, but seems like that was the conversation. So he goes to the 18-year-old, goes to the psychotherapist. The psychotherapist says, you like video games? He goes, I love video games. He goes, all right, for an hour a day, every day, you're going to close your eyes. You're going to pretend there's a spaceship, that you're in this spaceship, and the spaceship is in your body. And you're going to drive that spaceship or fly it to, like Galaga, exactly. You're going to fly it over to this tumor. He had shown him what the tumor looks like on imaging. MRI and CTs.
So he had a good visual.
So he knew. He goes, you're gonna fly up there in your spaceship. You're gonna look for this tumor, and you're gonna shoot it, and you're gonna shoot the cells in the tumor, and you're gonna make this tumor shrink. And you're gonna do this for an hour a day, every single day, with your eyes closed. You're gonna pretend you're playing a video game. And you're gonna do this. So this kid goes home and starts doing this. Does it for an hour a day, every day. A few months later, he tells the therapist. He says, listen, I've been shooting this tumor, and it's getting smaller. It's the size of a penny. Sometimes when I fly up into my brain, I can't even find it anymore. I really have to look for it to find it, and there isn't much to shoot at anymore. So can you order a second MRI so I can see where it is, and so I can shoot the rest of it? And he goes, let's talk to your neurosurgeon. I can't order MRIs. He talks to the neurosurgeon. So this is the person presenting to us. And he told him, I am not going to order another MRI. I'm glad you're feeling better. I'm glad you're happy with how things are going. Your vitals certainly look good. We're going to leave it alone. If I do an MRI and you see that the tumor has actually gotten bigger, which I believe it has, you're going to be very discouraged and very disappointed. It's going to ruin everything. The only way I will order another MRI is if you hit your head. If there's trauma, then we'll order another MRI. So this kid goes to the playground, intentionally falls off the monkey bar, bangs his head on some kind of a bar or something, goes to the hospital, and then the neurosurgeon says, all right, order the MRI. So they do the MRI, and guess what? The tumor is the size of a penny, exactly as the kid said. And this is the neurosurgeon talking to us, presenting to us, and said, I couldn't believe it. He literally shrunk his own tumor.
Right.
That's placebo. No pill, no sugar pill, no water, no actually putting anything, but mentally going in and doing things. And there's stories like that everywhere.
Yeah, start searching it because there really are. And it really goes to show how magnificently we were created, right? Like these are the things that go, you cannot contest creation
No.
when we hear things like that. Do you know what I mean?
Yeah.
So that's just so cool. I love it.
And the article, they talk about brain imaging that shows that the placebo works by prompting certain regions of the brain to secrete endorphins. I mean, you can get your body to release endorphins by exercise as well, and through visualization techniques and hypnosis.
Cool.
We release endorphins when we expect to feel better. So just expecting to feel better releases endorphins, which makes you heal faster. This mindset contributes to the perception of reduced pain and other symptoms such as anxiety and fatigue. The improvement of symptoms is related to activation in the brain regions linked to cognition, including expectations. I don't think we need to get too far more into this article. It says it really works, and the whole experience was life-changing. This is the person who had that back pain related to scoliosis. And so anyways, placebo is very, very real.
Yep.
We didn't end up arguing. Which is
I know. I'm so sorry.
Yeah, sorry guys.
Do you want me to pick a fight with you?
Yeah. Maybe on melatonin. But anyways, so whether you think a placebo is a drug, I believe a placebo is a drug. It's the only drug without side effects, but it is a drug. You guys should take it. If you put a vitamin in your mouth, expect it to work. If you put water in your mouth, expect it to work. If you take a breath of fresh air, expect it to work. Just set your expectation on only good things go into this body, and that's an act of self-love, and you will experience health benefits way more than you would have, because the opposite is the nocebo effect. If I convince someone that broccoli is poison, I promise you the minute they take a bite of broccoli, they're going to start vomiting, and they're not going to feel good.
Yeah.
Because they believe it's poison. Expect good. Expect only good.
Let's jump into melatonin because we are running out of time, and this is a big article.
It is. We may make it a part 2, but so melatonin. Why everyone over 50 must take melatonin? I saw that title and I was so extremely skeptical because everything I had read about melatonin and research and all that stuff said you don't need melatonin because first off, your body produces it when you sleep at night in the dark, so you shouldn't need it. The only time you should need melatonin is in very low doses, like 3 milligrams, 1 to 3 milligrams, and that's only if you're in a different time zone or if there's a time change or you're traveling, you're sleeping in a different room.
Yeah, you
and it's
were
hard to
actually
fall
really
asleep.
against it for a while.
I have always been against it.
Yeah.
Daily supplementation with melatonin, I've always been against. So this article, I was very reluctant to even read it. In fact, I've been carrying this around for, I think, about 6-7 months.
Yeah.
I just didn't want to read it. I just kept it.
Which is really funny because one of our favorite patients who's been with us for like ever.
Yeah.
Like literally like 15 plus years.
Yeah.
You know, he's a wellness patient.
Yeah, he gave it to us.
I think he's younger now than he was when he first started.
He's going to Soldier Fit and he's working out.
It's very
and
impressive.
He looks amazing. He
does.
fit. His wife too. He looks fit and strong. And you look in his eyes. He's got this confidence that is just amazing. And his stomach is going down.
Yeah,
like
it's really cool
to see. He looks good.
Yeah.
You're right. He looks and feels 10 years younger.
So thank you so much. We appreciate the article. I'm sorry it took him so long to read it.
Yes. It says, if you are over age 55, your natural melatonin levels are now close to nothing. Melatonin levels are very high in childhood and adolescence, but start a steady decline in your 20s. By the time you reach your 50s, your body is producing about 5% of what it did in your prime years. The main reason our prime years are prime is because that's when we produce an abundance of melatonin. So I'm still skeptical when I'm reading that part.
Yeah, I had no idea. It's produced everywhere in the body. The pineal gland. Did I say it right that time?
No, pineal.
I did it right the other day.
Melatonin is so important to overall health that it is produced everywhere in the pineal gland, in the brain, and in most tissues in the body, including the intestinal tract, the retina, the eye lens, the cochlea, which is part of the inner ear where hearing takes place, the trachea, windpipe, the skin, liver, kidneys, the skin I knew, liver, kidneys, the thyroid, the pancreas, thymus, spleen, and in reproductive tissues. The only ones I actually knew before this article was the pineal gland and skin. I thought that's the only place melatonin is produced. It is present in nearly all bodily fluids: cerebrospinal fluid, saliva, bile, synovial fluid, amniotic fluid, urine, feces, semen, and breast milk. Feces is not a fluid, but anyways. A healthy body on average produces up to 360 milligrams per day of melatonin. That is huge. Melatonin. Most of that is produced in the intestinal tract. Now, new findings have shown that one of the reasons mitochondrial function is so vital is because the mitochondria are pivotal for melatonin production, melatonin metabolism, and melatonin receptor activity. As they become less efficient, the mitochondria produce less melatonin. The result is premature mitochondrial decay, leading to premature aging and greater susceptibility to disease. Also, I've always been so skeptical when they say this one thing affects everything. I've never liked that. I don't like the monocausal theory of disease. I always think it's a combination of things. But anyways, I'm impressed by some of the things it's talking about. Also, the levels of melatonin are significantly higher in mitochondria than in the blood. Incidentally, this is why it is useless to try to measure melatonin in blood, saliva, urine. Due to the fact that so much melatonin is intracellular and not in the bloodstream, these tests only account for a tiny fraction of the body's total melatonin. So there's no way to know if you have enough in your body.
Yeah, and then there's a half-life and whatnot that gets brought into it.
Yep.
So
melatonin is unique in that it is soluble both in water and fat. This means that it can freely flow among all body tissues, across cell and mitochondrial membranes, and across the blood-brain barrier. It's important for optimum brain and nervous system function. Literally everything. Melatonin is the most important mitochondrial antioxidant because it is the only antioxidant that can penetrate the mitochondrial membrane. Like, why isn't this common knowledge? I mean, it makes
come on, we know why it's not common knowledge.
Yeah, I guess so. I mean, but
it's the same reason why they've changed how everyone looks at vitamin D. It's why they changed how people look and how we
they really downplay
process
the
and create vitamin C. Like, vitamins in these minerals, these nutrients are so vital. And what have we done? We've taken the importance of all of this. We block this information. We then push ultra processed food in front of people, unclean water, all of this stuff. We don't do parasite cleanses anymore. I'm telling you, call me a conspiracy theorist, if you will.
We have people asking us for parasite stuff still. Melatonin not only maintains mitochondrial balance and protects against decay, it also regulates the expression of our genes and controls inflammation and immunity. One of the ways it decreases inflammation is by blocking the pro-inflammatory COX-2 gene. COX-2 inhibitors are a lot of painkillers are based on that same pathway. It is important for optimal immune function because it stimulates Th1 immune helper cells, TREGs, and Th17 immune cells. If that is not impressive enough, melatonin plays a critical role in programmed cell death, apoptosis, making it important for cancer prevention, cancer growth, and senescent cell removal. Senescent means like cells that aren't working well, like disease cells. The body finds those and removes them as well.
Are they talking about autophagy? Is that or it's different?
Kind of, yeah.
Okay. A different kind of autophagy.
Not necessarily, but yeah. Because autophagy is when you fast and then the body starts to eat your own body for nutrition, and it always starts with the diseased cells and cells that aren't working. So they eat the old cells first before they attack the healthy bone and muscle cells.
So this is that same kind of thing, but done outside of fasting. It's a regular process.
It's like cleansing of the cells, yeah. overall age-related decreases in melatonin production are correlated with disease and dysfunction. In vitro and in vivo studies demonstrate melatonin's protective ability against mitochondria-mediated injury in hypertension and obesity, suggesting that dietary supplementation with melatonin in later years may be an effective therapeutic intervention for such age-related conditions. Did you guys hear that? Obesity and high blood pressure. Listen, I think we're out of time, and I think this is a big topic.
Yes.
Consider that a teaser, because I don't want to rush through this.
Yeah.
And I want to talk about I'm learning with you right now. And this is brand new for me because I knew nothing about melatonin until I saw this.
Yeah.
And we're going to dig deep into it. Join us next time.
Yeah.
Let's continue on this and let's really learn together on what we need to do.
I love this article because it did go through so many like individual like disease processes and things that we deal with as we age, and some we deal with outside of even aging issues. But I also dug in and did some research, and I want to continue that. I'll do some more before the next one. But, like you said, when people say, oh, it impacts all of this, it's not like there's one thing that can impact everything, but it looks like this has legs. It's going everywhere. Like your body really, it's a vital nutrient or
Even
a vital
though
hormone.
I've been skeptical, I have a hard time disagreeing with the things
The research,
saying.
the research is good.
Now, don't start taking melatonin yet. Wait. Let's go through the article. Then we're going to do some more research on dosing and when to take it and how to take it and some of those things. And then we'll talk about safety issues and when can it be toxic. And
I think we should really break down like how it's produced, what it is, what affects it in the body.
Absolutely.
I started researching vitamin D in conjunction to melatonin because I knew melatonin was, good for sleep and the sleep cycle. That's kind of all I knew about it though.
Yeah.
And then I'm like, well, the opposite of that is being out in the sun. So there has to be some type of day-night connection.
There's always a connection. Everything is a cycle in the body. Everything is a cycle and a rhythm.
Yeah. So I did some research on that, and I came up with some really, really great stuff. So
All
I'm
right,
excited.
Very good.
All right. So we just created our first cliffhanger.
Okay, bye. Just kidding. Let's go read.
Gotta go.
Well, I appreciate you joining us. Please let us know if we can do anything better for you. We love and appreciate you greatly. We pray that you're healthy always, that your families are healthy and well, and that we can constantly bless you with any information that we can. We're going to bring back a couple of old-time favorites from previous episode. I won't tell you who. We'll let that be a surprise. And then we're working on another high-level guest that's going to give you some information or news that is not news yet. So this is someone who has inside information on some new technology that is just still secret. So we're gonna hopefully have this person on the show. We're gonna actually go meet with them in the next few minutes.
Yep.
To see if they want to be on the show, and then we'll go from there. So take care, God bless, and we'll talk to you soon.
See you next time.
This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.